Well, allergy season is here. We've been talking about it all morning, and it seems to be one of the worst allergy seasons in years. The biggest concern for many people who suffer from them is what to do, how to recognize the symptoms, and what to do next. For advice, we turn now to First News contributor Dr. Michael Sevilla. He's here this morning. And you said you were an allergy sufferer as a child, so was I.
Yes.
We both took allergy shots. Does it work?
It does work, but people have to have the right kind of expectations for it. The shots, they take even a number of months in some people to work, so it's definitely not a quick fix type of treatment.
Okay, and you said you as a child took them. I had them, I was 10, 11, 12. Is it ever too late to depend on those allergy shots, you know, to work?
That's a good question, because I have a lot of people who most of their life don't even have allergies, but all of a sudden they start to have allergies. So allergy symptoms can start anytime, and allergy treatments, especially allergy shots, they can start anytime, and they work.
And you said, interestingly though, not all insurers cover those costs of the allergy shots. So that's also an issue sometimes where people may not start that up. So then their other alternative, if they're having trouble, they're not going to go through the testing or the shots, is over-the-counter medication?
Absolutely. I mean, there used to be that allergy medicines only used to be prescription, but now in the past few years, a lot of those have changed over to over-the-counter medicines, and all of them are very good. Even the over-the-counter treatments, even like saltwater nasal sprays, neti pots, in addition to the over-the-counter treatments, they're still a pretty good place to start.
What do you think about the saline? Because a lot of times too, they tell you when you use some of the nose sprays, you have to be careful with what's in them and so on, even if they're not prescription. So is the saline the safest bet, especially when we're talking about kids? What do you think?
It absolutely is. It's kind of the same theory as the kind of the neti pot. The neti pot is kind of salt water.
You cleanse.
And you cleanse in there. And a lot of the problem is just clearing out the nasal passages from all that pollen, especially in the morning, because in the morning is kind of when the highest concentration of pollen is, between 5 a.m. and 10 a.m., which really affects people like people who exercise in the morning or work outside in the morning.
Right. Now, we've had such a dry season, and that's what they're saying. That's why they're saying there's so much pollen in the air and so on. Allergists are reporting up to 3 times as many people coming through their office. Are you seeing the same thing? More people coming in and complaining about the symptoms?
Yes, we are. Actually, and it's very interesting, because I have a lot of my patients that come in and say, well, I usually have these symptoms in June or July, and they're having them right now. So they're recognizing their symptoms and coming in earlier to go ahead and get treatment.
Okay. Some of the simple things, if you don't, you know, you're using the medications and so on, you can't tell people just stay indoors and keep your windows closed, can you? I mean, what are some of the good hints and tips that they can do, you know, past the medicines?
Well, a lot of it is to kind of recognize how bad your reaction is. A lot of allergies, the same process is real similar to asthma. So people who have real bad asthma attacks, sometimes I tell them, you know, have your medicine, or even don't go outside, you know, in the morning, or keep your windows closed overnight, especially people who have very severe reactions.
Okay, and you said again, we just want to reiterate, if you're one of these people who opens the windows early in the morning to get the fresh morning air, that's exactly the wrong thing to do, because what, pollen counts highest in the morning?
Yeah, pollen counts is highest between 5 a.m. and 10 a.m. And people, you do get a nice fresh batch of air, but it's full of pollen in the morning.
Full of pollen. So if you're going to open your windows, maybe evening is better.
It is better for pollen
5,
counts.
6 o'clock, okay. Because some people say, I don't care what happens, I'm opening my windows. They can't stand it. They want that fresh air inside, fresh with pollen. All right.
That's right.
Thanks so much, Dr. Sevilla, and we'll give people hope. I mean, there's hope out there. Keep trying maybe different medications until something works.
Okay.
All right.
Thanks.
Take care. And still to